Hello, our dear viewers. You're welcome to our YouTube platform, Health Tips and Tricks. It's your physician, Dr. Andrew, to take you through. And if you're new to this YouTube channel, kindly subscribe so that you continue receiving our videos to improve your health. So today we are going to be looking at a concern from our friend from Texas. He says, "Hello, Dr. Andrew, Health Tips and Tricks. I am Thokozani from Texas. My mother was diagnosed with kidney disease and was started on medication. Am I also at risk of developing it?" So we are going to talk about the risk factors for developing kidney disease so that we can assure our friend from Texas that that his mother developing kidney disease doesn't mean that he also has to develop what? Kidney disease. So what are some of the risk factors? Most importantly, we should know that kidney disease is a disease which affects the kidneys, and the kidneys play an important role in the body because they help to filter toxins out of your body and let them out through the urine. So if your kidneys become sick, this ability goes away and you end up having complications that affect your body and make your life miserable, if we could say. So what are some of the things that can predispose you or increase your risk of getting kidney disease? Number one, we have a disease called diabetes. Some of you have heard of diabetes. We have talked about diabetes previously in our videos, and we have seen that diabetes is a disease which perturbs your body's ability to deal with your blood sugar. So if you have diabetes, you will have high chances of what? Of acquiring kidney disease. How does this happen? Diabetes will cause injury to the kidneys, and this can progress and becomes chronic kidney disease where you have to either be on medication or, if it comes to the late stages, need a new kidney or other replacement methods like dialysis. Number two, we have hypertension. All of you know this as blood pressure. When your blood pressure goes up, it can affect your blood vessels, and some of these blood vessels affected are those which are found in the kidneys. And with the disease of blood vessels, the kidneys also get affected, and this can progress to chronic kidney disease, which may need you to get a new kidney. Then we also have cardiovascular disease. We talked about the heart, and we saw that the heart is a necessary organ in the body because it pumps blood to the rest of the organs in the body. So if your heart is sick, if you have cardiovascular disease, then you are at risk of acquiring kidney disease because it is one of the organs that receives perfusion or blood supply from the heart. Then we have lifestyle activities. For example, smoking. Smoking is a lifestyle which is common among certain groups of people, but you should know that smoking, especially tobacco smoking, has a detrimental effect on your health, and it can also affect your kidneys. It will interrupt the blood supply, it brings toxins in the body, and all this can affect your kidneys and lead you to develop kidney disease. And then, of course, we have obesity. Obesity is another feature which people can get. This can be genetic predisposition, but it can also be because of our lifestyle, the kind of diet we eat, and also the kind of activity in our life. So if you have obesity, obesity is another condition that can predispose you to kidney disease. And then we have things like ethnicity. For example, research and studies have shown that being black, Native American, or even Asian American increases your risk of acquiring kidney disease. How is this so? Different ethnic groups have different genetic makeup or genetic composition of the body. So research has shown that some people who are black, Native American, Asian American have genetic factors which predispose them to acquiring kidney disease, and so they have a higher risk than the rest of the population, or to be specific, the white Europeans. And then we have other things like family history. For example, our friend from Texas, his mother had kidney disease. So it means he also has a certain degree of predisposition or risk of acquiring kidney disease because it is within the family line. And then we have abnormal structure of kidneys. And under here, we shall talk about some people are born congenitally with kidneys which are not of normal structure like other kidneys. You can have things like horseshoe kidneys, kidneys with cysts. You can have also sometimes the problem may not be necessarily in the kidneys, but for example in the bladder or in your ureters. And if I could just use a diagram to demonstrate a certain condition which is common and is called vesicoureteral reflux. And if you look at your kidneys in the body, these are your kidneys. So your kidneys will produce the urine, and the urine moves through certain tubes called ureters. And the ureters will, once the kidney moves through the ureters, it comes to your bladder. This is your bladder, the urinary bladder. And from your urinary bladder, out comes the urine. So sometimes some people are born with certain abnormalities where they have certain abnormalities along this pathway that don't allow urine to flow smoothly and come out. And some of these abnormalities can predispose them to getting kidney disease. How? Because there will be reflux of urine. So urine will flow back to the kidneys and make them sick because it cannot flow properly to come out through the normal passage. So that's what we call vesicoureteral reflux, and it's another factor which can predispose you to kidney disease. So some of these abnormalities you can be born with them, or some you might even acquire along the way because of different conditions which you may get during your livelihood. And then we have frequent use of over-the-counter medications, and medications which are sometimes not prescribed by a clinician or your doctor. We have drugs like painkillers. The common painkillers, we use drugs like ibuprofen, drugs like drugs like ibuprofen, drugs like diclofenac. These drugs can also predispose you to kidney disease, and also other additional drugs. Most drugs, because the kidney helps in handling some of these drugs in the body, they can affect it and make it sick, especially if we take them in large quantities or in without proper prescription from a doctor. And then we have, of course, age. As you age, all the organs in your body age. Their blood supply, their makeup, their cells, they all age. And the kidney is no exception. As you age, your kidneys also age. And with aging, you are at risk of acquiring any form of kidney disease, which can progress to chronic kidney disease, necessitating you to get replacement therapy. And then we have infections. Kidneys can also get infections just like any other part of the body. And if you are a person who gets frequent kidney infections, this can predispose you to getting kidney disease. And of course, we have other conditions. For example, among the pregnant women, there's a condition called preeclampsia and eclampsia. This is a disease in which pregnant women will get a high blood pressure and other complications, for example, seizures and fits. And this condition can also predispose to kidney disease because it has an effect of damaging the kidneys. Then we have other conditions also like obstructive sleep apnea. Again, this is related to obesity. Some of those people who are obese and have a thick neck, and they find it difficult to breathe, especially at night when they are asleep, what we call obstructive sleep apnea. So people who have this condition get at risk of acquiring several diseases, including hypertension, and kidney disease is another one which is among them. So our friend from Texas, these are some of the risk factors which can predispose you to getting kidney disease. If you're out there and you have any of these in your family, then it's time to start visiting your physician or your doctor more frequently so that you can have checkups, that in case of any kidney disease, you discover it early and then you start treating it accordingly. And some of these can even be reversed. So, for example, the question in hand, our friend's mother has kidney disease, so it means he has a risk factor which is family. It is in the family. So, by going for regular checkups, he is able to detect the kidney disease at early onset and thus do necessary interventions to prevent progression and to live a healthy life. Thank you very much. I remain your physician, Dr. Andrew. I hope this was helpful, and continue subscribing so that you can continue learning more from this about your kidney health. Thank you.